anyways, let's get back to the reason why I'm making this video. And I've started using my, I have a Keurig coffee maker. That's been sitting there for I don't even know how many years. And now I'm like addicted to it. I don't know what took me so many years to figure out how yummy, delicious coffee is making it that way. But anyways, okay, you think I'm procrastinating? I'm totally procrastinating, guys. Because I just don't want to get emotional again. But I think I need to let this out because so many people have asked, you know, how did your surgery go? I've had a couple people actually ask, you know, did you get the extra skin removed? Because I had mentioned that in one of my videos. Well, I think this video is going to be titled, The Grass Isn't Always Greener on the Other Side. Because, let's just put it this way, and I meant to make this a fast, quick one, but I've rambled so much about birthdays that now it's already 7 minutes, and I told myself I was going to make this 7 minutes long. So, I'm going to kind of speed this one up, because it's not so happy of a video anyways. Okay, so, before surgery, I had my first appointment with my surgeon 4 months ago. At that appointment, we talked over what he was going to do. My main concern was my endometriosis, my pain levels, my medication. I wanted to be free of that. I knew I had tons of adhesions, scar tissue, you name it, all that stuff. So that was the main point. Well, at that visit 4 months ago, back in the beginning of December, when we were discussing it, the surgeon also mentioned that he could remove the skin off my stomach, the extra skin off my stomach from losing so much weight. He also told me during that same visit back in December, he said, now, you know, we'll try to do a scar revision, you know, and see if your insurance covers it that way. But if not, you could still get it done. You'll have to pay out of pocket, and it'll be around $3,000, maybe a little bit more. So I had plenty of time. You know, I you know, penny pinched a little bit during Christmas. You know, just save. Sold some stuff. Pretty much, I did what I needed to do to make sure that either way the ball rolled, I would be guaranteed this scar revision, aka tummy tuck. Okay. Well, I kept calling for that 4 months before my surgery, I kept calling the office, kind of getting the runaround, wasn't really getting guaranteed answers, whatever. My pre-op appointment before my surgery, when I went in, it was a different doctor. They work side by side. They were both in the surgery. I don't know what the difference is, but it was a different doctor. And she even examined me, and she's like, oh yeah, they can definitely remove this part of your stomach. And, you know, and of course I lit up again. You know, and she said right then and there, you know, he's not a plastic surgeon, but he does really good tummy tucks. I mean, those were her words. This was a week before surgery. And so I even asked again at that point. So everything is on point with it. Everything is scheduled for, you know, scar revision, aka tummy tuck. And she said absolutely. She even gave me my paperwork that actually said scar revision. And I think I had mentioned in my video that I wish it said something else to make me feel a little bit better, to just guarantee that that's what that meant, but I would take it for what it was worth. So the day of surgery, sorry I'm making this long again, guys. The day of surgery, they were already backed up like 4 hours behind. So I had to sit there for 4 extra hours in that bed with the IV, ready to go into surgery. The first time both doctors came in to me, the first thing out of his mouth was, now remember we had discussed, you know, the tummy tuck and stuff like that, you know, that your insurance may or may not, you know, frown upon that. And he said, you know, your insurance isn't going to cover it. And he was discussing, you know, about, you know, how much approximately it would cost and what I wanted to do. And so I said, go ahead with the tummy tuck. I have the cash. Well, he had this puzzled look on his face all of a sudden. He was shocked that I said that. Well, then the secondary doctor went right out of the room, and then he left out of the room. The nurse came in to do some blood work or whatever she was doing over here. At that point, I was so like, it's not going to happen. It's not going to happen. This is exactly what I was talking about. It's not going to happen. So I started talking to the nurse about it, and she goes, do you realize your insurance will drop you if you pay for a service at the same time they're paying for a service? She's like, I've seen it many times. And so right then and there, when she said that, I lost all hope. I lost all hope. I'm like, why? Why did they ever bring it up? Why? If it was never a possibility either way, whether my insurance ended up covering it or whether I paid cash, I mean, if it wasn't going to happen, why did they ever bring it up and make me think that it was a possibility? So at that point, I was just bawling. I mean, I was bawling. I was so crushed and so devastated. So then both doctors came back in. Sorry, I spit. Both doctors came back in and explained the same thing the nurse just did, saying that my insurance will drop me if I pay for a tummy tuck at the same time they're paying for a different surgery, which was not at all what they told me back in December. They said that it would be cheaper to pay cash for the tummy tuck during the surgery because the surgery would already be paid for, the anesthesia would already be paid for, the operating room would already be paid for, everything would be paid for except for the actual procedure, which was slightly different than a scar revision. And how they explained it was, a scar revision would be going from tip of scar to tip of scar, which I have a long lower way down by my pelvic bone, from C-sections and a hysterectomy and everything like that. So I've got a long scar way down below that goes from side to side. And they said scar revision, they can basically take from tip of that scar, tip of that scar. But a real tummy tuck, he would want to go, further back, like on the back side. But in my head, again, I'm thinking, well, either way, I only have that front droop. You know what I mean? So I know cosmetically it's probably not going to be as pretty as a tummy tuck, but at least that bulge would be gone. So I already had it in my head that I didn't care how pretty or ugly it was going to be. I just wanted it gone. So they came back in explaining all of that. I was bawling. I finally stopped and said, you know what? This isn't at all, this isn't why I'm having this surgery at all. This surgery is to get me out of pain, to get me off of pain meds so I can live a decent, normal life. The tummy tuck was a bonus. And I just finally had to really sit there, I had to pray about it and just focus my energy on remembering why I was there in the first place. Because at this point, even the doctor was like, well, we could stop what we're doing, we can reschedule, and I'm just like, oh my gosh, like, what's going on here? Like, what is going on here? Like, everybody was focused on this tummy tuck at this point, and I was over it. I was so over it. I'm like, stop. Everybody stop. I don't want to hear the word tummy tuck anymore. This isn't why I'm having surgery. We need to let it go, and we need to move forward. And let it go. Let it go. And so, seeing how upset I was, the doctors were talking, and they were apologizing. Right in front of me, they were apologizing how miscommunication between the two of them and whatnot, and what they can do to help me at this point. One doctor said, they'll take off as much as they can. It may not be pretty, but they'll do the best they can. One doctor said, should we mark her? The other doctor said, no, don't mark her because then it will look like we're trying to do a tummy tuck. We'll take care of you is what they said. We'll take care of you. I don't want to say that I got a botched scar revision or I had a botched job or I had a botched surgery, because They did find my ovaries and remove them, which was a struggle with the previous surgery that went horribly wrong. They fixed a lot of internal things, a lot of adhesions. I mean, they did miracles when it came to the actual reason they were in my stomach to begin with. When it comes to the scar revision, yes, they took care of a scar. I had a scar going up and down from an emergency perforated bowel surgery, and I had an up and down scar, and they had to open that scar up at one point because I had an infection, and it healed just really weird, and it folded over itself, and it made my belly button fold over. So anytime I would sweat, I would just get rash, horrible, stinky, gross rash. And it was constant, especially in the summer. I live in Arizona, guys. So they removed that scar. So yes, technically they did a scar revision. But as you're going to see in a moment, it seriously looks like they did a tummy tuck on one side of my stomach and completely left the other side alone. I don't understand it at all. I did have one post-op appointment to remove my staples, and then they put the little steri strips on, and I didn't mention it. I was totally fully going to mention it, but something made me stop, and so I didn't. But I guess I want to understand what happened and why I look the way I look now, because honestly, this is way worse than I was before surgery. I had a droopy stomach before surgery, but at least it was even. And I know I had said before that it was like uneven a little bit, but my stomach may have been a little bit uneven like this, but now it's totally like this. This part is totally sucked up and, you know, it's swollen still, but it's sucked up and tight and taken off. And this side is still dangling. I'm going to show you in a minute. It looks horrific. It feels horrible. When I try to put my underwear on, there's like a big gap. Like I could literally drop stuff because of my clothes are fitting. I know that I'm still swollen and I'm still recovering, but I don't think it's going to get any better or maybe even worse. I don't know. My biggest thing is I don't understand why, if they took so much off of this side, why they didn't take it off of this side. I do know that 2 different doctors did 2 different sides because they told me when they came to visit me in the hospital. One doctor was showing me what she had done to tuck in so I wouldn't get a dog tag. And the main doctor had said, yes, she did this side. So I don't know if it was the fact that they weren't talking to each other, or if they purposely did it, or if it was an accident, or there was a reason. I guess I want to know why, but in the end it doesn't really matter why, because it's not like I can go back and rewind and have this fixed now. So this is the part where you need to turn off your camera if you guys are gonna get grossed out. Sorry about my boobies. So, alright, you ready, guys? I can't believe I'm doing this. So, this is my after. Oh, can you see? There's where the incision is. All the way across, excuse my underwear. There's the incision. And this is what my stomach looked like before on both sides. And they totally did this side. And this side is the side that has that knot that got filled up with blood, hematoma or something like that. So I know that it's still really, really swollen. But they totally took this side and like basically did a tummy tuck. But not this side. I totally don't understand. And my belly button is in here somewhere. It's just really swollen. And this is where they took, this is the little, this notch right here. This was part of that surgery, that up and down surgery. And this is actually where they had to open it back up. They opened up this part, and then they opened up a part down here, and they had to let it drain. Well, this part down here is not there anymore. It's gone. They completely, so that's the scar revision that they did. This is the scar revision that they did. I don't understand. So, I mean, do you guys see what I see? That this side is totally done, and this side is totally not. I can tone and do the best I can with this, or I can leave it that way. I don't have a problem with that. But now I've got this big bulge down here. I don't understand. So, yeah, when I put my clothes on, it feels so weird. I know I'm still healing and stuff like that. You know, and like, see, when I have my clothes on, now you see this big bulge right here, and it's totally flatter over here. I mean, before at least it was both a big bulge, and then I could either just put tighter underwear on or just tighter clothes. But now there's this big bulge over here. So, yeah, I don't know. What do you guys think? Do you think that, I don't know. I mean, either way, it doesn't really matter what anybody thinks. I can't go back. I can't rewind and get that fixed. I mean, I don't think. And even if I could, even if I went into their offices and said, look what you did to me, fix it, do I really want them to? And even still, I don't think that that's even a possibility. I think it is what it is, and I'm so torn with my emotions. I'm so thankful and grateful to them for fixing the problem that I went in there for. But I'm so disappointed and devastated at how they left me. I almost wish that I would have never even been mentioned about scar revision or mentioned tummy tuck. I almost wonder what the outcome would have been if that would have never been on the table. I wonder if I would still just have my droopy skin on both sides, and just, and it is what it is. I've lived like that since, I lost the weight, so it would have been the same. Or, I don't know. I have so many questions that I don't know if they need to be answered, or I don't know if I need to let them go. Anyways, this is a 30-minute long video. I'm going to have to cut it some way or another. I will talk to you all later. Love you guys. God bless.